Okay, good afternoon, everyone. My name is Ben Ranciere, and I am the Curriculum and Training Coordinator for the University of Michigan's Project Healthy Schools. And we are really excited to have you here today joining us on this beautiful sunny afternoon here in Southeast Michigan. I hope wherever you are, you're having just as pleasant weather as we are here. We're here this afternoon to talk about the Building Healthy Communities, Engaging Middle Schools through Project Healthy Schools, and the funding opportunity that is provided along with it. Building Healthy Communities is a collaboration between several organizations here in Michigan, and that you can advance to the next slide, please, including Blue Cross Blue Shield of Michigan, the University of Michigan's Project Healthy Schools, Wayne State University Center for Health and Community Impact. And the Wayne State's program, they work with the elementary schools on health and wellness programming. So if you are interested in bringing a health and wellness program to an elementary school of interest in your district, please feel free to reach out and we would be more than happy to connect you with the wonderful folks at Wayne State. We also partner with the United Dairy Industry of Michigan and the Michigan Fitness Foundation. Okay, moving on. Again, I am Ben Ranciere. I really apologize that you can't see me for some reason. My camera is not functioning properly, so the technology gremlins have reared their heads here on me this afternoon, which we certainly apologize for, but here I am. I am again the Curriculum and Training Coordinator for Project Healthy Schools with degrees in educational leadership, physical and health education, and a fun little tidbit, I'm also a youth sports coach, like maybe some of you are as well. Just finished a season of youth volleyball with my daughter and youth basketball with my son, my 5-year-old son. So that was a very interesting experience to teach 4 and 5-year-olds the wonderful sport of basketball. Okay, some logistics about our time here this afternoon is, first of all, copies of the slides will be emailed out to you following this afternoon's webinar, so you can have reference. Please feel free to share out with your colleagues accordingly and your school administrators. Throughout the session, please feel free to use the chat or Q&A feature. We'll be monitoring that throughout this afternoon session, and we want to make sure that you leave here with all of your questions answered. Of course, at the end, we'll provide you with some follow-up emails. If you have additional questions beyond our time this afternoon, please do not hesitate to reach out to ask those questions as well. So again, you can post the questions or comments using the Q&A or the chat, which we will be monitoring again during our time here. Note that you should hopefully be seeing the live transcription at the bottom of your screen. You may turn that off by clicking on the closed caption box, the CC box, and then on hide subtitles. And then also this meeting will be recorded and again shared out for those interested in reviewing the information that we covered here this afternoon. All right, so what are we going to be talking about here this afternoon? We are going to be discussing many things. Be talking about the Building Healthy Communities Collaborative, which we've talked a little bit about already, the program itself, who is eligible to apply. We're going to talk a little bit about the program and how it would be implemented at your school, the resources that are provided to you as a participating school within the Building Healthy Communities Collaborative, some expectations on your end, things that we expect of participating schools in order to ensure that this is a meaningful and beneficial experience for not only the school staff, the school community, but of course the students that we are serving through this initiative. How to apply for the program. We'll talk a little bit about the application process. We'll be passing along those links if you are unfamiliar of how to apply. Some of the criteria for selection. This is a competitive process. Unfortunately, we do always receive more applications than we are actually able to submit on an annual basis. And so we'll talk a little bit about that, and then key dates. to make sure that the application comes in on time, and share a little bit with you about the process. Once the application has been submitted, where do we go from there? So please do not hesitate to, again, pop in questions to the chat or Q&A as we're reviewing information. Also, I'll save a few minutes at the end to, again, cover any questions that we haven't covered already. All right, so the current landscape in schools and across the state and across the nation. I'm sure this comes as no surprise to many of you, but a little over 1 in 3 children in Michigan are overweight or obese. And we certainly understand that your mission, our mission in being school-based professionals is student achievement and student outcomes. And so how does this relate to that? Well, we know that healthier students are healthier learners. And it's interesting that although our brains only account for about 2% of our body weight, our brains consume about 25% of the calories we consume. So it's really important that we are providing our brains, the brains in our students, with healthy, nutritious foods that will, help them perform cognitively throughout the course of their day. We also know that physical activity ties into that. And the more opportunities we can provide for students to be physically active throughout the course of their school day, the more we know that they will be alert, engaged, and feeling good in order to learn. And so, trying to get away from that, hey, if a student is in a seat, a student is learning. And we know that that's not necessarily the case. We need to make sure that we're meeting those nutritional and physical activity needs of the student to help them overcome some of those barriers to learning and make sure that they're engaged in the learning process, which will certainly improve their academic outcomes, but their long-term health, long and short-term health outcomes as well. So how do we go about supporting that? Project Healthy Schools is a Michigan Medicine community collaborative meant to improve the present and future health of students through education, environmental change initiatives, and engaging the whole school community. And we'll bring along a lot of resources as we engage in this journey together of supporting student health and wellness. The next slide is about our reach thus far. So the program started back in 2004 by a cardiologist here at the University of Michigan, Dr. Kim Eagle. And since then, we've served over 88,000 students across the state. We've also served students in the state of Arizona, as well as we have several schools in the country of Bangladesh as well. But here in the state of Michigan, we've implemented the program in over 140 schools. I think it's important to highlight that this is not a one and done program. We certainly understand that behavior change takes a long time. It's not something that happens overnight, within a week, throughout a month. It takes time to support behavior change. And that is why we continue to support schools beyond year one, because we know with a lot of competing priorities in school that this is certainly a marathon and not a sprint. And so many of the schools that we have started the program in across the state still continue to partner with us in supporting student health and wellness far beyond year one. So what do we work on? We have some overarching goals, and by the end of the program, these are some of the things that we certainly hope that students engage more in, which include eating more fruits and vegetables, making better beverage choices, so trying to properly hydrate themselves with better beverage choices and choosing less sugary foods and beverages, eating less fast and fatty foods, so focusing more on the healthier fat options, healthy fats within the diet, certainly being active every day, before school, during school, after school, working with schools to ensure that students get those 60 minutes of physical activity each and every day. And then, of course, spending less time in front of an entertainment screen. The next slide highlights some of the impact that we've had with students. So the statistics you're seeing here are from our freshman schools last year, so our first year schools last year. And so by the end of next year, after implementing the program, after just 1 year, here are some of the changes you can expect to see. Almost 60% of students are eating more fruits and vegetables, and there's a variety of ways, and we'll talk a little bit more about that here in the next few minutes of how we encourage students and promote healthier food options. More students being physically active, choosing less sugary foods and beverages, and spending less time in front of that screen when they're not required to do so. So spending less time on that iPad, watching YouTube videos, or my kids are watching Ryan open up toys, which is certainly baffling to me. So just working with students to get them away from those iPads when there's opportunities to do so, and get them out and get them moving throughout the course of their day. So who's eligible to apply to the program? So public schools, charter schools, private schools, all eligible to apply as long as they are physically located here in the state of Michigan. You're also able to apply regardless of your free and reduced student counts or student lunch. Geographic location, you saw on the map a few slides ago, we have schools spread out through across the state, including, I think we're over 20 schools in the Upper Peninsula now at this point as well. So that is not a barrier to being eligible to apply. Schools must serve students in the 6th grade to be eligible. So you see a variety of school formats: K-8, 3 through 8, 6 through 8, 5 through 8, but just making sure that your school has a 6th grade. Now, schools that have participated in other Building Healthy Communities programs. So if your school has previously been awarded a Building Healthy Communities grant, either through Step Up for School Wellness or the elementary program through Wayne State, which I referenced earlier, if your school has received either of those 2 programs in the past, your school would be ineligible to apply. However, if you have received maybe a Safe Routes to School grant or other health program grants out there, you would be eligible to apply. So if again there's any questions on that, please feel free to pop that into the chat. But those schools who have received other Building Healthy Communities programs in the past would be ineligible to apply. Okay, so let's start to dive in a little bit about how we go about implementing the program. So this next graphic, you see the 5 steps to school wellness, starting with step 1, and you're seeing that kind of clockwise circular pattern around step 5. This is a continual process. So each year we'll go through each of these 5 steps with you at your school. And then it will again repeat the next year. And so building support, we're going to talk a little bit more in depth about these, but just to kind of give you an overall sense of how it goes, we'll start with building support early on in the year. We'll also work on assessing the current school environment early on in the year before we make an action plan, which includes kind of SMART goals, school-wide SMART goals for student and staff health and wellness. And from there, we're going to initiate an action plan. So that's teaching lessons, so engaging students in educational opportunities to learn about social and emotional wellness, nutrition, physical activity. And that's also the step throughout the course of the year where we will be engaging in what we call policy systems and environmental change initiatives, which we'll dive a little bit further into here in the next few minutes. At the end, we'll do some measuring, and we'll use that measurement data that will again help us give us more data points leading into year 2 to see, which areas did we improve on, which areas do we need to continue to improve on in subsequent years. And again, we'll go through that process annually. All right, all of our materials that will help guide you through this 5-step process, along with your Project Healthy Schools Wellness Coordinator, is our Project Healthy Schools portal. So we have an online login protected portal, which houses all of our materials, all of our lesson materials, all of our assessment materials, all of our wellness initiative ideas and templates, which we can provide you, training videos, up-to-date newsletters, things like that, all housed on our portal, which again, you'll continue to have access through well beyond year one. All right, so on the portal, as I said, we're going to start with step one, building support. And that actually process has already kind of started here. If you're on the call, you're you're probably most likely to be one of our wellness champions. So through the program, you'll be assigned a Project Healthy Schools wellness coordinator. That wellness coordinator is going to work with your wellness champions. So essentially, that is our school-based liaison where we work through to implement the program. And so these wellness champions are in charge of this implementation of the 5 steps. We do use a gradual release kind of model, teaching model. So to start, as we go through each of the 5 steps, your wellness coordinator will kind of be leading the way and really showing the wellness champion what it looks like. Here's the resources that can help you throughout the process. And then as we continue to go through the 5 steps on an annual basis, we'll be releasing those responsibilities over to the wellness champion, and the Project Healthy Schools Wellness Coordinator will kind of just be a resource and continue to help when and as needed. Once we have those wellness champion or champions, again, it's up to the school. And if there's one thing that I can hope that I can share with you throughout our time is the flexibility of the implementation. And so, what a wellness team looks like at one site will, be completely different from another school. So wellness teams will be working with your wellness champion to form a school wellness team. That is a collection of interested, school community members, students, parents, other teachers, food service, who meet regularly, kind of help with the assessments, help to organize ideas and implement those wellness initiatives that we'll again talk about in just a few minutes. We also provide a ton of resources that will engage your school community, your parents, along with our educational materials. We provide parent packets. So following each of our Project Healthy Schools nutrition and physical activity lessons, students take home an activity page where they become now the teachers and they teach their families to engage, the home within these wellness efforts. So just one example of how we engage the school community. We also have a public website that offers a lot of resources as well. Okay, step 2, the assessment. So we know that there's a lot of opportunity within a school setting in regards to health and wellness, and assessments really kind of help us pinpoint where's the starting point, where's the launching point, where do we need to address first. And so we'll go through these Healthy School Action Tool assessments. There's 3 assessments that we will work on. There's a core assessment, a healthy eating assessment, and then a physical activity, physical education assessment. And once those assessments are completed by a school staff member, wellness team members, we will then use that information in step 3 to create our action plan. So there we'll create some SMART goals. We'll create a nutritional SMART goal. We'll create a physical activity SMART goal. We'll create a staff wellness SMART goal. We know that the more healthy role models there are within the school building, the more meaningful this type of programming becomes. So we'll create that action plan. We'll create those SMART goals. And then from there, we will use that to take action. So this is really the fun part. And this is where we kind of we've built supports. We've made, the school community aware of what we're doing and how we're going to go about doing it. And now here's when we're actually going to start. Like I said, the really fun part. And that includes teaching the 10 PHS nutrition and physical activity lessons. And brand new this year is a social emotional learning curriculum provided through Trails, which I will talk in a little bit more depth here in a few minutes. So we're teaching the lessons, we're educating students on these important concepts, and then we're working to change the school environment to allow students opportunities to practice what they've learned. So throughout the course of the year, we recommend, kind of 1 per quarter, we will implement some school wellness initiatives through policies, systems, and environmental changes across your school. After we do that, like I said, we will, let's see here. Let's go to the next one here, Nate, just to talk just a little bit, a brief overview of our lessons. Since the pandemic, we have created some alternate versions to implement these lessons. So we now offer your traditional classroom-based lessons where we provide all of the lesson materials for hands-on activities. We've created synchronous versions of the lessons, which are essentially short instructional snippets led by a certified health education teacher. These are meant to be facilitated by a live teacher, but can be, through a virtual teaching setting. We're not obviously quite sure what next year will look like. But we have, a variety of models to support the implementation of these lessons. We also have an asynchronous version, which is essentially a recording of an entire lesson video, which students can watch and then participate in the lesson activities asynchronously. We also, as I said, this year are adding some social emotional learning lessons to students within the school. And this is through a partnership with the University of Michigan's TRAILS. TRAILS stands for Translating Research into Action to Improve the Lives of Students. And we're offering 20 lessons per grade level. They're about 30 minutes, and they can be delivered on-site or remotely as well. And the lessons cover the 5 areas: self-management, self-awareness, reasonable decision-making, relationship skills, and social awareness. So we are really excited to be supporting students, really working to support the whole child now with physical activity, nutrition, and social emotional learning. So I'm seeing a quick question here from Lori. Thank you, Lori, for adding the questions. We are a 7th and 8th grade building. Are we eligible? Yes, in fact, we are starting to see a lot more 7th grade health education elective classes popping up across the state, which is wonderful to see. And it is a great location to implement the Project Healthy Schools lesson. So Lori, your school would be eligible to apply as a 7th and 8th grade building. All right, let's talk just a little bit more about these wellness initiatives. So if we could advance to the next slide. Here we have a little bit of a breakdown. If you're not familiar with PSC changes within the school environment, policy changes refer to formal written statements about organizational decisions and standards. So we will work with you to revise your school wellness policy. Examples of that would maybe be incorporating, I know as a former physical education teacher, I would get sometimes frustrated when students would get have a punishment and their teacher or administrator would withhold them from participating in physical education as a punishment. And so that goes against the science, right? Because we know that physical activity has such a huge impact on cognition that is really putting the student at a disadvantage to improve. And so we can work with you on implementing language that would help with that. That maybe we could also work on making sure that we're using nutritious snacks and not handing out empty calorie snacks throughout the course of the day as a form of reward. So I'm working on with you on policies such as those, working on with you on systems. That's referring to how we do things, right? So changing the organizational procedures or rules, and they often work hand in hand with policies. So there's examples here that have popped up on the screen. And so which of these 3 refer to a system change within your school? So take a look at those 3. Revamping your school wellness policy, that obviously refers to policy. But which of those? Work with students to design nutritional signage for the lunchroom, or working with food service to put unhealthy options out of view? Which of those do you think would be an example of a system change? And if you pick the red, working with food service to put unhealthy options out of view, you would be correct. So working with food service staff. So maybe we're working with them to put healthy snacks. So we know that students kind of tend to congregate around that checkout area. So placing healthier snack options there where they tend to congregate and maybe have a few extra minutes to grab a healthy snack, and putting those unhealthy options out of view is an example of a system change. Environmental changes refer to changing the actual physical, social, or factors that affect how people behave. So changing the physical school environment, allowing more opportunities for students to, before school gym or after school gym. This year we worked on some virtual culinary classes for students. So allowing students to join us via a live Zoom call, where we provided them all of the ingredients to prepare nutritious meals. So really changing the environment and how they interact within that environment that really helps support those behavior changes that we're looking for and partner with you on. All right, so after we've completed our education and worked on our assessments and implementing our wellness initiatives, again, we're going to circle back at the end. We're going to do some post-program surveys, and then we're going to use that survey data, that information that will again help us to support necessary changes, continue to support necessary changes in the school, leading into subsequent years. All right, and I know I'm getting close to the end here, and I know that it's 3:56, and I want to be cognizant of everybody's time. So I'm just going to share out a little bit with you about some of the resources that are provided to you. As I said earlier, you will be provided with a Project Healthy Schools Wellness Coordinator. This person will help with on-site and remote consultation to assist with the implementation of those 5 steps. This includes training, guiding, providing materials, assistance, again, using that gradual release model. We provide a variety of educational lessons, including the 10 lessons, the 20 SEL lessons, with a variety of implementation models, as I discussed earlier, and ongoing access to these materials in subsequent years. More resources that will provide is funding. So we know that we're asking the wellness champions to go above and beyond their regularly scheduled duties, and we compensate that with a stipend to support the time and effort that it takes the wellness champion to work with our Project Healthy Schools Wellness Coordinator on the implementation of the program. Once we've done our assessments and created our action plan, we will provide funding to support your wellness team and your wellness team initiatives, those PSE changes. So for example, maybe we identify healthy eating as a high priority area within the school. We can do food tasting within your cafeteria, purchase the healthy foods for students to come up and sample, to introduce them to a variety of nutritious, healthy foods. And then we can use that information, find out what students like, and use that information to influence the menu offerings through the food service department. You're seeing funding for CSPAP equipment as well. So we've talked a little bit about before and after school physical activity programs or during school physical activity programs, working maybe with your school to implement playground zones on the playground. So if your school offers maybe a lunchtime recess, hopefully it does, we can work on implementing some playground zones to encourage more students to be physically active during that time. We also have a wide wellness champion network. We'll have opportunities to engage with other wellness champions through our annual wellness champion gathering. We can communicate through our portal as well, social media, and we have a wellness champion gathering and other trainings throughout the course of the year where you can earn those sketchies or those continuing education hours as well. All right, some expectations for schools. Obviously, we want active wellness champions and administrative support throughout the process, regular meetings with your coordinator, completing those assessments to guide and create a program that is tailored to the needs of your school, implementing the 10 physical activity nutrition lessons and the 20 SEL lessons, completing those at least a minimum of 4 annually of those PSE wellness initiatives, administering those program measurements that we discussed, sharing some photos and success stories of how the program has made an impact on your school staff and students, and then a commitment to sustaining those wellness efforts beyond year 1. All right, so how to apply? You can go directly to our projecthealthyschools.org website, and you can click on Apply Now, or you can click on the link that you see here. The application is to be completed right through that web page. And the application is due no later than midnight on May 31st, 2021. What does a competitive application look like? Again, this is a competitive application. We will receive more applications than we can fund. So obviously ensuring that your application is complete. So you'll be asked, where are the 10 lessons going to be taught? Where are the 20 SEL lessons are going to be taught? So we're hopeful that those conversations are happening now with your colleagues at the school. So we have a placement for those, and that should be identified on our application. A level of commitment and engagement from the administration and staff to complete all 5 of those program steps. Identification of those classes again, where the 10 lessons will be taught. Identification of the wellness champion. So who's going to lead these efforts? Again, it could be 1 or more champions. Sometimes it's 1 individual. Sometimes it's 2. Sometimes it's a whole team of 6th or 7th grade teachers. Again, what's going to be most effective at your school? And then a level of commitment to improving, the health of the school through policy change, systems changes, environmental changes that we have talked about. The last thing is the timeline. So again, applications due by May 31st. Following those applications will be being submitted. We will reach out to you to schedule an interview. We'll meet with you for about 30 minutes with the wellness champion and the school administrator, just to learn a little bit more about your school. Kind of talk through some of the things that we think are important to successful implementations. And then we will be announcing the awards for fall implementation during the week of June 20th. So a fast and furious finish here. Again, if you have any questions, please pop those into the chat. And we will be happy to address those. And I'll be more than happy to stick around for a few minutes and allow you some time. But also feel free to reach out. My email is here directly, brancier@umich.edu. More than happy to answer any questions you may have, schedule a phone call to discuss in additional detail if that's helpful to you as well. Or feel free to reach out to the Project Healthy Schools team at umich.edu. So always amazed, quick 30 minutes. I can't thank you enough for taking the time to join us this afternoon to hear about the Building Healthy Communities, Engaging Middle Schools Through Project Healthy Schools program. Again, if you have questions, please feel free to pop those in the chat. We will be sending out the PowerPoint, the webinar recording to you following up. If you have any questions between now and your application submission, please do not hesitate to reach out. We thank you very much for joining us, and we hope you enjoy this beautiful sunshine and the rest of your afternoon. Thank you.